I want to tell you about something that every seasoned clinician knows. And it's not the kind of thing you would necessarily find in a textbook, but you find it when you are sitting by the bedside of a patient, talking with them about their stories. It's the kind of stories that we share among colleagues in the break rooms over coffee as we talk about cases that raised some questions or curiosity. And I want to tell you about it because it's the kind of thing that has completely changed the way that I look at health for myself, for my family, for the patients that I serve, and I hope it will be helpful for you too. So, as always, I want to make sure that we get an opportunity to make sure that as I'm going to talk, I'm going to cover a lot of data today, and I have to say I had to hold myself back because I was so excited about some of this data. I tried to keep it concise. There's way more than I'll be able to cover today, but I want you to, as always, listen for what feels important to you and might be something you can use in your own life and jot it down. And also listen for a friend, for something that might be helpful, or a colleague that also, or a family member that might be useful. And as always, I appreciate that I am a learner in this topic too, and every talk I try to approach with humility and understanding. So I put my, let's see if we've got my email up here. My email's up here, so if there's something I say that doesn't sit the right way with you, or you feel like I could learn from, please, or you have a thought, I would love to hear it. So feel free to email me, and I'll try my best to write you back as well. I want to tell you a story about someone I'll call Betty. It's not her real name. So the things to know about Betty. Betty had a sparkle in her eye, and she had a raucous laugh that could just completely fill a space. I met her in her 90s, and she had, at that point, lost her partner of many, many decades, and but was doing well. Her focus became caring for the home that they shared, and also tending her beautiful rose bushes in the front yard. And she did really well. She was independent for many, many years, and then one day she had a fall, and then she had another fall, and her family started to think that maybe it wasn't so safe for Betty to be in the house anymore. And so, like many older adults, she got moved into a nursing home. And some time passed, and I got a call one afternoon from Betty's son, and he said that Betty had passed away, and he wanted to let me know. And the thing that was striking about Betty was that she was in really good health almost her entire life. And so I couldn't help myself. I had to ask, what happened? And her son said, well, it's kind of a curious thing. We, about 6 weeks ago, she told us all she was done. She said she wasn't depressed. She just said she was done. And then he said some words that I want to share with you today that frames our topic. He said she lost her will to live. So the will to live, what is that? It's that drive and motivation that helps us see us through challenges that we face in our lives, or when we're facing life-threatening situations. And it's something that's actually recognized around the world as a part of being a human being. You know, whether we're in Okinawa as Ikigai, or if we're in Costa Rica as Plan de Vida, it's something that's seen but not always appreciated by medicine. But it raised this question because in those conversations over coffees with colleagues, we've talked about that it's a very poor prognostic sign when somebody says, or you get the sense that a person has lost their will to live, depending what their challenges they're facing. But it also raises the question of what's on the other side of that? What are we missing? And could it be that somehow a will to live or a sense of purpose can help us actually live better and have a longer health span, a period of time where we're in good health? So let's find out, shall we? All right, let's do it. So we all need a reason to get out of bed in the morning. And I have to say, I know that everyone in this room has and also online that's watching this, has a reason to get out of bed because you're here, you're at this conference, and that is an incredibly important start. And right now, we are really, and by the way, I was thinking, this looks like someone on her way to Oahu. Because that's how I felt coming here. Isn't this just incredible? We are all right now waking up to this incredible science about purpose. But this is not how medicine is typically thought. And you're probably thinking, like many people, in medicine, we typically deal with crises once they arise. We don't always look at sort of how we can prevent things and help people live with longer, what we're now calling health spans. And also, people might say, well, it was just Betty's time, and that's entirely possible. But what if there's something on the other side of that? So let's look into that. I am now going to cover 3 different areas, and I really wanted to pack in more. I'm going to focus on these 3 just to start, and I want to walk you through some of the data of this incredible emerging science about the connection between purpose and health. And I also want to add, this is not a new idea. So this is Viktor Frankl, who many of you have probably read Man's Search for Meaning or are familiar with his work. And he said this quote, "Those who have a why to live can bear with almost any how." He's paraphrasing Nietzsche here, but it's from his lived experience, of course, during the Holocaust in the concentration camps and the horrors that he saw. And what I find really interesting, actually, is that he actually started to study the connection between purpose and health and psychological well-being in medical school well before all the events that took place that we now know him and think of him for. And he, in his work, describes how he started to see that people who lost their sense of purpose under the extreme duress of the conditions, that sometimes he said that people would be dead within 24 hours, which is pretty striking. And the thing that is really striking as we now look at this increasing amount of data around this topic is that he was right. It turns out that not only does purpose affect our well-being, it also affects us physically. So the first area I want to talk about is this incredibly interesting area called psychoneuroimmunology, which was a field that was started about 40 years ago. And what they do is looking at one of the areas that is done in this is looking at purpose in life and sort of high purpose in life, and this idea of like how do you measure purpose in life? So there's something called the RIF scales, and some of the studies that I'm about to reference use that, and this is just an example of those questions, but you can also ask it to yourself. Some people wander aimlessly through life, but I am not one of them. So here's what we know. So the studies show, and there's more and more different areas this is focused on, that a high life purpose, or PIL, because we love our acronyms in medicine, is associated with a number of things, including higher quality of sleep, better ability to fight off different infections, better cognitive functioning, which we've heard about several times today, including some impressive data around the ability to stave off dementia, and even with evidence of disease, stave off dementia, and then also mental well-being. But the question is, how does that work? Like, what exactly is the mechanism behind it? And this is where this field comes in that's really exciting, is that it seems like what might be the underlying mechanism is that, in fact, higher life purpose is also shown with to affect the immune system. And so lower inflammatory markers, including things like IL-6, which kicks off this cascade of cytokines and other forms of inflammation, and then also cortisol, which might actually be the precursor to all of those good things that we just talked about a moment ago. Just another area of interest that I thought I would mention, because the data is quite striking around cardiovascular health. So again, with high life purpose, we're seeing things like a lower risk of heart disease by 44%, a lower risk of stroke by 72%. This last statistic for me is a bit personal, actually, because my mom died of a very massive stroke, and it was interesting because in the months preceding the stroke, my husband and I had started to talk about how it seemed like she had lost her sense of purpose. And so anyhow, it's just one of those things that stands out. All right, but the big question, and I'm so excited because we all want to know, well, does purpose actually help us live longer and better? Let's find out. So I'm going to cover, this is just one study of many, but it's got a particularly beautiful graph that I just can't wait to share with you. And so this was an article in JAMA, which is a very well-known medical journal, looking at the association of life purpose and mortality among U.S. adults. And they had a good sample size of almost 7,000 adults. And what they found was that indeed, life purpose was significantly associated with all-cause mortality. And here's the exciting part. Well, of course, it's a modifiable risk factor, which in medicine is what you look for because there's some element of control. And it just feels like that's why I'm here today, because this is a really important message that could impact your health as you think about it and the health of your loved ones, just how critical this is. And something that's not in our textbooks yet, but it will be. And so this is something that's known as a survival curve. And I know it looks kind of intimidating. We're just going to focus on this little part right here. And all right, so get ready for it. So a survival curve is, so what we're looking at is a dose response here. And so the higher the sense of purpose on the surveys that was done, the longer somebody lived. And in public health and in medicine, that's exactly what you look for a treatment that works. So very exciting. So I'm just going to summarize the data for you here really quickly. All right, so this is when you look at all the data together, and this is actually something from the blue zones, that it looks like it's probably 7 years of good health that high life purpose can afford you. And I just want to say, even if that's off by a margin, my goodness, because there are many people that would take a tablet if it could extend their life 1 more year, but let alone this is something intrinsic in all of us that we can tap into. So we are going to do that. There you have it, just your sense of purpose. And I thought this was very funny when I was putting my slides together. And I'm glad nobody else has used the joke yet. But anyhow, thank you for the chuckle. So purpose, like we might as well just all live with it, right? But of course, the fears start to come in, and the excusitis. You know, I'm too old, too young. You know, I don't have enough time, enough money, all of those different things. And of course, the reality that we get tough diagnoses, and the people we love get tough diagnoses, and that can stop us in our tracks. And it can sometimes feel like we've totally lost our way. So the question is, how do we find our purpose when we feel lost? And I know that that's a theme that's coming up many times today. And as Ala mentioned, sometimes we can also relish in those moments of understanding that it's actually fabulous to be at that moment where we get to make new decisions and new paths forward in our life. I'm going to share with you what I'm calling 3 doses of purpose. And they're just little doses, but I thought they might be helpful for you to sort of think about ways to maybe infuse more purpose in your life. And they're fun. They're from sort of different areas. The first is if maybe you've identified a problem as failure. So I don't know if anyone knows who this is up here, or might say it on there. I don't know. It's Thomas Edison. So Thomas Edison was asked while he was trying to create the light bulb, he said, I haven't failed 10,000 times. I've successfully found 10,000 ways this won't work. And so with that, I would ask you the question, and this is something just to think about and sort of jot down, because it really comes down to a dose of trust, like trust that you're on the right path. Some people might use the word faith. But what would you do even if you might fail? Or what are you doing now that you just feel and you trust is right for you, even though maybe the world's saying it's not, maybe you're not getting the results that you want? But that's part of purpose, and so pay attention to that and tuck it away and keep thinking about it. This other problem. I mean, this is one I think I've used too busy. So I want to share a story with you, and I'm going to walk over here because I feel like I've been neglecting this side of the room. So I was boarding a flight, and it was busy, and everyone was in a rush, and all of a sudden I heard, "Hello, this is your captain speaking," and everyone kept going about their business, not really thinking about it. And then all of a sudden, I hear, "Hi, this is your captain. If you want to see me, come look up front." And there's a fellow at the front of the plane in a captain's outfit waving. And he introduces himself as Captain Eric. He says he's going to be taking our flight that day. And he then proceeds to tell us all about the route from A to B where we're going. And it was incredible because all of a sudden, the tenor on the plane changed from a bunch of sort of disgruntled, disinterested passengers to a level of excitement, almost like we were going on a field trip together. And then the really interesting part, and he also thanked all of the people on the flight that were helping that day. And it was just this really sort of lovely communal moment. And we got into some turbulence on the flight, and it was funny because in my mind I thought, you know what, Captain Eric's got it, we're okay. So anyway, afterwards I stopped and I asked him, how did you decide to do this? And he said that one time he had heard somebody doing this and that it seemed to really create a very good feeling on the plane. So he thought, why not? I'll just do this. I will just step out and do it. And he said that for him, he loves flying so much that he just wants everybody to have a good experience. And he wants to convey that passion. And if they're nervous flyers, let them know that it's going to be okay. And I just thought, that's the kind of thing where it's like it just takes a dose of creativity in your daily life. You don't actually have to go out and do anything different. You can still, he was busy. He was getting ready to do that flight, but he still managed to infuse this moment of joy, which was really amazing. And then also too old. This is Nola Oakes. She's the oldest graduate. And this is a dose of learning. She went to school at age, she graduated at 95. She said this quote, "Set a date to begin, do something, don't just sit there." And sure enough, she didn't, because she actually went for her master's right after that and graduated at 98, actually lived 7 years to 105, and she got to live her lifelong dream of teaching on a cruise ship along with her granddaughter by her side. Who also graduated at the same time. So just in closing, I just want to say this. We all know that life is so much shorter than we wish it were, even under the best of circumstances. And we now know that this data is showing that purpose can help us live longer and better. It's just one piece of the health puzzle, but it's an important one that has been often overlooked. And I just want to, as we put it all together, think about, what would it take to, add a dose of, a little dose of trust and creativity and learning to your life. Because here's the thing, the reality is it's not just the will to live, and it's a theme that we've been talking about throughout. It's actually really the will to love. And it's the will to love and to be loved. So with that, my time is up. Thank you very much. And also, I look forward to come talk to me at Wahasu. I'm looking forward to seeing everyone. Thank you.